If the Cadillac tax does make it into the final health care bill, what could it really cost you?
A fair and balanced debate now. Dr. Sreedhar Potarazu says, unfortunately, it's going to cost everyone a lot. Mark Lieberman says, well, not so fast. So, Doctor, first to you, I brought up this study by the head of the Medicare and Medicaid services. He's the actuary. He's crunched the numbers. He said it's going to cost us all much more than just $200 billion over 10 years.
Yeah, you're absolutely right, Dave. And that's exactly what they said. And even though some of the Democrats in the House and the Senate keep coming back and saying, well, it depends on who's evaluated it, the bottom line is, as I said time and time again, is that these bills are going to cost us more. If we end up taxing these Cadillac plans and you play out this scenario, what's going to happen probably is that employers may adjust the premium so that the plans pay less, but you and I as employees will end up paying more out-of-pocket expenses. Okay. Now, simply taxing these plans without factoring in where I live or the conditions that I have is really a game of Russian roulette, because what's going to happen is some of these people end up in the wrong plans. It'll end up costing the average individual much more later.
Dr. Potarazu, it is a fact that if we were in charge of our health care bills, we would be more careful that they came down in price and increase in quality. But a lot of what they're doing inside the Beltway is taking choice away from us.
Well, it's taking choice away, but we're not even starting off with choice. I mean, nobody's going to disagree that the consumer has to be better educated. But if you send a college kid into a library and say, look, over the next 4 years, you can study whatever you want, they're going to be lost. That's what we're doing to consumers right now is, yeah, they need transparency, but there's so much more that has to happen to give them the visibility in terms of what doctors really cost, what doctors fare in terms of particular treatments that are available out there. There's a huge ramp up and a huge curve that we've got to go up in order to educate the consumer before we actually get to that point.
You've hit it perfectly to say we have to educate the consumer.
Up agreeing with each other, so I guess that's a good thing. There's nothing wrong with agreeing with each other. Dr. Potarazu, Mark Lieberman, great to see you both. Thanks very much.